Hello, my name is Liza Baxter, and I am a nurse in the emergency department at Clearfield Hospital. Today I'm going to be talking to you about myocardial infarctions, or what you might know as a heart attack. I'll start off by explaining to you what a heart attack is. I'll go over risk factors that make you more susceptible to having a heart attack than others might be. I'll explain the signs and symptoms that come along with having a heart attack. I will also give you a description of what testing is done to diagnose a myocardial infarction, and I will finish with prevention tips. A myocardial infarction is the medical term for an event commonly known as a heart attack. It happens when blood stops flowing properly to the part of the heart and the heart muscle is injured due to not receiving enough oxygen. Usually this is because one of the arteries that supply blood and oxygen to the heart develop a blockage. The arteries that supply the heart are called coronary arteries. The blockages in these arteries are caused by atherosclerosis. Atherosclerosis is a gradual process by which plaques of cholesterol form on the artery walls. Blockage of a coronary artery deprives the heart muscle of blood and oxygen, causing injury to the heart muscle. Risk factors for having a myocardial infarction or a heart attack can include elevated cholesterol, high blood pressure, tobacco use, diabetes, being of the male gender, and having a family history of heart disease. Signs and symptoms that you might be having a heart attack usually are chest pain. Chest pain or pressure is the most common symptom of a heart attack, although heart attack victims may experience a variety of symptoms, such as chest pain radiating through to your back, or chest heaviness or a squeezing sensation of the chest. Other symptoms can include jaw pain, toothache, headache, or shortness of breath. Nausea, vomiting, or the feeling of indigestion or heartburn can sometimes delay people from getting prompt medical treatment. Becoming sweaty is also a common symptom. Arm pain, specifically in the left arm, but may be in either arm. And sometimes there are no symptoms at all. Approximately 1/4 of all heart attacks are silent. This means there is no chest pain or any new symptoms. Silent heart attacks are especially common among patients with diabetes. Even though the symptoms of a heart attack at times can be vague and mild, it is also important to remember that heart attacks producing no symptoms or mild symptoms can be just as serious and life-threatening as heart attacks that could cause severe chest pain. Often patients attribute heart attack symptoms to indigestion, heartburn, fatigue, or stress, and may delay seeking prompt medical attention. Tests to help diagnose a heart attack can include an electrocardiogram or ECG. This is a recording of the electrical activity of the heart. Abnormalities in the electrical activity occur with heart attacks and can also help identify the areas of the heart that have been injured. A patient with typical symptoms of a heart attack and characteristic changes of heart attack on an ECG can help diagnose a heart attack more quickly, and treatment can be started immediately. If a patient's symptoms are not typical, and if there are already pre-existing ECG abnormalities, for example from an old heart attack, this makes interpretation of the ECG more difficult. In these patients, the diagnosis can be made hours later through blood tests. Blood tests to diagnose a heart attack are called cardiac enzymes. These cardiac enzymes are typically elevated in the blood several hours after the onset of a heart attack. Currently, a blood test called a troponin level is considered the preferred lab test to help diagnose a heart attack, as they are indicators of injury or death to the heart muscle. The risk of a recurrent heart attack decreases with strict blood pressure management and lifestyle changes. This includes smoking cessation, regular exercise, a sensible diet for those with heart disease, and limitation of alcohol intake. People are usually started on several long-term medications after having a myocardial infarction or heart attack, with the aim of preventing further events such as a heart attack. So I want to stress the importance of seeking prompt medical attention in the presence of new symptoms that could suggest a myocardial infarction. Early diagnosis and treatment saves lives, and delays in reaching medical assistance can be fatal. A delay in treatment can lead to permanently reduced function of the heart due to more extensive damage to the heart muscle.